Hello everyone, I wanted to come on with a quick update about, and maybe not a so quick update, because I got a lot to say, but an update on my ongoing knee issue with which a lot of you have been keeping up on and know that I've been suffering in a lot of pain, chronic, very severe, very intense pain. I'm up for a total knee replacement, and I've scheduled surgery now. We've scheduled surgery now in Eugene, Oregon for September 3rd, I believe. The big issue is, though, I just got an MRI done recently, and they said that there was more fluid that they've ever seen on a knee in it. And I thought, okay, the girl's kind of young, she's had a few years at this, that means it's extreme, but I'm sure there's been others. Then my specialist slash surgeon here says that it's the most fluid he's ever drained from a knee, because he drained my knee, and I'm telling you people, that was worse than the everyday knee pain. I've never been in so much pain or discomfort in my life, and I am doing everything to never have to do that again. But long story short there, it ended up with me being in so much pain I was screaming out during the procedure and crying in front of complete strangers and staff, and that's never a fun thing. And trust me, anybody that's ever been in extreme pain will tell you dignity kind of goes out the window at times. But anyway, when he removed the fluid from my knee, there was blood in it, a lot of blood. And he doesn't know why I'm bleeding into my knee, or he thought behind my knee. So he referred me to get a second opinion and to go to some blood specialists, because he was afraid that I have a blood disorder. This new surgeon looked at it, and he thinks that my kneecap is out of place, which it is, because the other surgeon has said that too, and that the cartilage is under my kneecap causing cutting and slicing into my tendons and veins and all that, nerves and all that, and that's what the extreme pain is. Because usually, even when leading up to a total knee replacement, you're in pain, but you can usually get by, with minimal pain medication. Some people are strong enough they can do it without, and good for them, but I don't know how. But none of the doctors could get on board with why I was in such extreme pain, or the fact that my knee had swelled way beyond its limits and wouldn't go down no matter how many anti-inflammatories. The draining, when he drained my knee, it popped right back up. And anyway, he believes this is the reason why I'm having extreme pain too. The blood pooling into my knee is agreed upon by all of them, and the new specialist, the surgeon doing my surgery, says that blood, once it hits the bones in there, it's like pouring acid on it. It causes more pain, as does the swelling and all that. But it was to the point where I was ending up in ER rooms, urgent care, in between my regular doctor and specialist, because they couldn't get my pain under control. I started on tramadol, which is a non-opiate, which if you have regular bone pain or knee pain, it has minimal side effects, and it's a good prescription drug to get on as far as that goes, for back pain especially. But that, of course, stopped working real quick into this, probably within the first month, because it just kept getting more unstable, and swelling kept getting worse, the pain kept getting worse. So they put me on hydrocodone, 5 milligram. Hydrocodone is a strong opiate, the weakest of all the opiates, besides codeine, I believe, but I'm not a doctor, so don't quote me on that. But anyway, excuse me, it's a strong drug. Then they put me on 7.5. That wasn't doing it, wasn't even touching it. So then they put me on oxycodone, 5 milligrams, three times a day, or 4 times a day at that point. Wasn't coming close. They upped me to 10 milligrams oxycodone, but then take it down to 3 times a day. And when you're in extreme pain and you've had to take pain pills, then you know what I'm saying is true when I say they only last for about 3 hours. 3.5 hours, 4 if you're lucky. And so I was having to wait 8 hours in between doses, so I'd be right back to holding my knee and moaning in pain, and some days crying sobbing even in pain in between doses. So I end up back in the ER again, and finally my nose itches. Finally, my doctor, my primary doctor, upped me to 10 milligrams 4 times a day. And right now, I'm in extreme pain right now, but it's doable. Extreme pain compared to what I was in. This is acceptable. This is, for a while there, for this whole journey up until about the last few days, I haven't so much as been able to concentrate on watching a movie, a YouTube show, a conversation. My own niece calls me and she needs me in her life, and I hit ignore and I have to message her and say, I can't right now, I'm in too much pain to concentrate. Or, the truth about it is I'm laying on the couch crying because of my knee. So now we've got me stable as far as medication goes for now. I'm staying off it the best I can. I walk Gypsy once a day, and then I take her outside to the field across the street. I inch myself over there, or my wife takes her for the rest of the day for decent walks. But I'm staying off it the best I can. I can't stay off it completely because I would have been laying on the couch the last 5 months straight. That'd kill you just to lay in one place. It really would. That's not good for your health at all. I stay off it the best I can. 75 to 80% of the time I'm off it and I'm stuck on the couch. I've had to cancel several events that I was booked to do. I haven't been to visit friends in a while. I can't drive my own car right now very well because it's not safe for me to do so, because it causes me so much pain and I have so little mobility in my knee that it's not safe for me or other drivers. So it's impacted my life greatly. So now we have surgery scheduled, but the elephant in the room is this bleeding still, which is a very serious issue. Let's rewind a little. The surgeon that's doing my surgery came back in the room after looking at my MRI and stuff, and I know we're bouncing around, people, so please follow along and forgive me. But when he read my MRI and stuff during the initial meeting, he came back to the room and he said, you need a total knee replacement. And me and my wife were both like, yeah, we kind of, we were prepared for that. We were just getting a second opinion because of the bleeding or this and that. And this is when he looked at us and he says, you need a total knee replacement, but it's not that simple. This is not good. This is very bad. He said, what's going on my knee, he's never dealt with. He says it's very extreme. It's very strange. He doesn't get it. Every one of these doctors, ER doctors, all of them are telling me that this is an anomaly, that this is rare, that they don't understand it, that it's unique, and that's a very scary thing. It really is, especially when it comes to blood disorders and bleeding when you're getting ready to have surgery. And my primary doctor mentioned a while back that she thought I was anemic, which is a bleeding disorder. And I don't know why she thought I was, or the numbers on the test results or this and that. Like I said, I'm not a doctor. My wife reads them sometimes, and she's pretty good at stuff like that. She's not a doctor either, but she's very intelligent, and Google helps a lot with it, being able to understand it. But needless to say, it's very worrisome, because I called my mother the other night to ask her if she could remember any kind of medical history that would lead her to think that she's hemophiliac, because my mom is anemic too. And diabetic. So she remembers getting a blood transfusion at some point, which is a big red flag, because most people go through their entire life without ever having to have a blood transfusion. And my mom's memory is not as good as it should be, and her brain doesn't work like it should. She's getting older, she has issues, she's on medication, so she can't remember the circumstances. But this has got me really concerned. It's got me really scared and really anxious, honestly. So we're doing tests, and we're going to make sure they do every test under the sun to make sure it's relatively safe to go into surgery with this. But I'm also concerned because every one of these doctors, and now the booklet that I've got to bring home, my pre-surgery booklet, talks about how hard the recovery is. And this doctor looked at me and said, your recovery is going to be harder than most. And it's a very scary recovery. Holy moly, it's terrifying. So between blood disorders, my natural fear of surgery, and now bleeding disorders. I'm spooked at the moment, I'm scared, but at the same time, I'm in such pain that this has taken away my life. Like I said, yesterday, the day before, and today have been the best I've felt during it, and I'm still I'm in extreme pain right now, but it's just so much more stable than what it was that I'm thankful enough that I can concentrate enough to do this and have a little bit of my life back, because it was really getting depressing. It was causing me anxiety, it was depressing me, and as a lot of you know, because I'm open about everything, I'm bipolar 2, which means I'm prone to depression. Not so much manic or mania, and I've never had to be hospitalized or anything, but I'm very prone to depression. I have anxiety issues, so it's very hard for me to even get worked up enough to go to a specialist, let alone to sign myself up for surgery, because it's the last thing I want to do. I avoided having a total knee replacement 5 years ago when a doctor in Roseburg, Oregon told me I needed one. But that was nothing. I went unmedicated after my last knee surgery, which was just an orthoscopy, as they call it, where they went in, cleaned out the cartilage, and cut one of my tendons to release pressure or tension, which they don't even do that surgery anymore, because a lot of the times it can cause more pain and this and that, which I wish I would have known, because I would have never had the surgery, and I honestly probably would have pursued court action at this point because of the damage that I feel like it did to my knee afterwards, and the fact that I didn't have physical rehab afterwards because Kansas wouldn't accept my insurance for it. But the statute of limitations has ended on that, so that's a whole nother bag of worms. But anyway, here we are. This is what's going on. I'm going to show you my knee real quick, both my knees, so you can get a good example of what's going on. Like I said, it's very painful. So painful that I make a lot of noise at night when I'm up with it, to the point where my wife can hear me in the bedroom. I sleep on the couch now because the bed's too hard to get up on, and because I can't keep my wife up all night tossing and turning and moaning and crying with my knee. But it gets so bad she can hear me in the bedroom from the living room. My 17-year-old son, who's down the hallway in his bedroom with the door shut and his TV on, can hear me and comes out here and checks on Dad because he's worried. It's a really bad situation. It's a very scary situation. But anyway, let's look at my knees. This is the knee right here. It's not all that terrible right now in comparison. Let's see if we can stretch it out a little. You can see the difference between the knees, definitely. Like I said, right now I'm fortunate the swelling has started to go down a little. For the first time in five going on 6 months now, I believe, or almost 5 months. Either way, about half a year. It's usually about 3 times this size, and that's not a joke. You can go back to some of my other update videos and see that, but I had it drained about 2 weeks ago, which, by the way, still feels like a screwdriver under my kneecap. I don't suggest you have that done. Besides, it might relieve a little pressure. It's not worth it. It's not worth the risk of infection. It's not worth the pain. I suggest that you don't do it, and this is just from my personal experience. But I had to switch surgeons with the second guy. The second opinion is who I booked surgery with because I feel more secure with him. There's also going to be another surgeon in the room when my surgery is done because they're worried that I've torn my quad muscle, which is the muscle that helps run the knee and, move it and does all the hard work. And they're afraid that this has tore my quad to where it's going to have to be stitched and repaired. So yeah, this is very serious. It's very scary. I'm going to keep you guys updated as we go along, as I've tried to. And I'm also trying to document myself living with chronic pain because it has been a living hell. It truly has. It's not fun having your life taken away from you. I feel so much empathy for people out there that have chronic pain right now and wish I could help them too. It's very scary. There's times during this where I honestly felt like I wanted to jump in front of a bus, and I mean that in a literal sense. because I just could not get away from the pain. Like I said, I've been in ER rooms, doctors' offices, crying, sobbing, to the point I have to have my wife communicate with them what's going on. And if I didn't have her as my advocate and my partner, I'd probably be dead right now. And that's not a joke. It's serious. So those of you going through a debilitating stage 4 knee pain, and that is what they call it, is stage 4, and it is to the debilitating point. I can't work, I can't make money, I can't drive my car, I can't deal with my dog like I need to, I can't go places with my wife like I need to. This is really bad. But anyway, I know that bounced around a lot because I ramble a lot, but I thank each and every one of you for tuning in and watching. And if you got to this point, I have a couple words for you in parting, and that is take care of yourself first and foremost, because we only live once, and you have to be happy, and you have to have a good life in order for you to be any good for anyone around you, including us as a collective. And number 2, be good to each other. We're all we got, people. We really are. And empathy is something we all need to have. It really is. It's starting to where it really makes me emotional, really breaks my heart to see people treat each other badly. It's really awful, guys. Let's do our best. Let's do better than our best. It's all about equality. It's all about inclusion. It's all about us helping each other as people. All right, guys. I've preached enough at you. God bless you. Have a great day. Thank you for watching. Please hit the like and subscribe. My wife makes a lot of homesteading videos on here. When I'm not in chronic pain, I post a lot of walking videos with my dog Gypsy. I do ukulele videos, media videos, movie reviews. Heck, I think on one night on here I even streamed Night of the Living Dead and watched it with people on here. But anyway, thank you so much. God bless you.